And again, that's physical rest, mental rest, rest from stimuli, and obviously rest from sports, because again, you want to avoid that re-injury, especially in the first month or two. I think you're way more susceptible. The next thing is what the body also needs is a lot of nutrients to heal. So, when we're sick, when we're stressed, when we're injured, our body goes into those reserves. We need more B vitamins. We need more magnesium. We need all of those nutrients for that healing process to happen appropriately. The other thing is reducing inflammation. So one of the other nutrients that's really important besides, your B vitamins, your C, your D, your minerals, is essential fatty acids. So essential fatty acids come from like fish oil. So that's your EPA and your DHA. That is what your body uses as its natural anti-inflammatories. We can't make them in our body. We have to get them from an external source. So you either eat fish or you can take a fish oil supplement. But that really helps to decrease the inflammation and to kind of help that healing process be completed. And then there's some other interesting kind of pieces. You heard of hyperbaric oxygen therapy? It's really, it can be really great for healing the brain. So you get into a chamber and you're breathing in kind of pure oxygen, and it's in a pressurized environment, and it sort of forces oxygen to those tissues, and it really helps speed healing. So if you get to that point where you're not getting better, that can be a really great adjunct. If it's a really traumatic brain injury, the sooner you start, the better. Probably not, something you're going to do if it's a simple concussion, but it's like when you start seeing you're a year down the road and there's still lingering symptoms, it's a really great adjunct.
Marissa, who has that around?
So there's a couple places. Okay. I don't know about down here. Okay. There's, I know the hospitals have them, but they use them more for like wound care. Okay. So if you have like diabetic ulcers or wounds that won't heal, and maybe they use it in severe traumatic brain injuries. But there are a couple places in Missoula, like the cryo method. Okay. There's a few kind of private practitioners that do have them.
Oh, that's good to know.
Yeah.
Yeah. Okay.
Yeah, it can be a really great adjunct.
Yeah.
I do know just because I know, but there's one in Corvallis at a physical therapy clinic.
Oh, okay.
That has it as well, just in case you ever see anybody from that area.
Okay. Yeah. Cool. And it's a great adjunct to anything else that you're doing.
Yeah.
And then along those lines, something that we do at our clinic as well is we do ozone therapy. So ozone is kind of, it's like oxygen is O2, ozone is O3. So it's like this, big oxygen molecule. We do, it's called MAH. So essentially what we do is like you can pull blood out of the body, we inject it with ozone, and then we put it back into you. And it's great for healing any kind of brain injuries, any chronic infections, chronic inflammation, can be a really, really great adjunct as well. Again, it's just like getting that oxygen to tissues because that is how we heal. And then there's other things like neurofeedback can be a really great adjunct too, especially if there are some like ADD, if there's some learning disabilities, if there are, lingering depression, anxiety, some mood disorders. Neurofeedback is kind of a way they kind of like map the different brain waves that are happening in your brain. So you have like alpha, theta, beta, and delta, and they can kind of see where it's going wrong, and then you can retrain your brain to kind of function appropriately. But that can also be a really good adjunct. And then one more thing that I use in my practice a lot now is something called low-dose naltrexone. So it basically stimulates your body to increase its own production of endorphins. And so endorphins play a huge role in mood regulation and kind of that feeling of well-being, but they also can modulate the immune response. So in any kind of a situation where there's inflammation that's out of control, so like in autoimmune diseases and cancer, infections like these chronic infections, brain injuries, it can be really helpful for, kind of helping the body to modulate that kind of excessive inflammatory response and bringing it back into into the range of normal. But we talked too about that gut-brain connection. So, we always think about the brain being this like isolated thing inside the head, and it's like there's this huge connection with the gut and the whole body. And so a lot of times what can happen if there is a traumatic brain injury, if there's a lot of inflammation throughout the body in general, it can throw off pretty much everything else that's going on. So there's this like the vagus nerve connects the gut to the brain, and it goes both ways. So information is traveling. So if you have these stress hormones and neurotransmitters and everything's kind of firing, it can throw off a lot of what's happening in the gut. And so you can kind of bidirectionally heal the gut and the brain at the same time. So
Very cool.
yeah, it is.
Yeah, so what I try to tell the athletes is, you want to fuel yourself like a Ferrari, right? So you want to eat really good, solid food, right? If you eat crappy, you're feeling a Geo Metro, and then don't be surprised when you easily get a concussion.
Yeah, it's really true.
Yeah.
It's really true. Yeah.
But high school kids are tough, right? Your littles are still eating what you tell them to, but high school kids are car keys, and then what do they do for lunch? They go to the gas station with their buddies.
And
Like,
that's,
So, so I think that's like a huge thing. And then also, like, if we're talking about concussion or baseline, if we have really good nutrition going into a sporting season, you're less likely to sustain a concussion.
And your healing is just going to happen way faster.
Mhm.
You're going to cut that 1 month down to hopefully 2 weeks. And you're going to be, much more back to normal than you would be if.
So you kind of
You're
reap
not
what you sow,
eating.
right? So if we're eating healthy and we're ready for game day every day and we get bumped, we're going to heal way faster. So
And from any injury too.
yeah, exactly. Yeah. So well, that is kind of our presentation. You guys had awesome questions on the way, but anything else you guys think of or?
Do you do the pre-baseline tests?
Yes, I do the
here?
SCAT-6 here.
Okay.
Yeah,
Okay.
exactly. So
Okay.
and
And
so
just-
we can get your.
You can schedule just specifically.
Yep, and it's a
for that, like,
30-minute
kids.
appointment.
Okay.
We take some time and
Yeah.
do X, Y, and Z. Corvallis, fun enough, who has the athletic trainer that is hired through Bitterroot Health. Actually, I was talking to her, and they actually are doing baselines on all of their athletes at the high school, which is really cool. So, and I think Hamilton's doing that too. Stevensville used to do that, but they're not doing it anymore. So it is what it is, but it's really nice to have a baseline done, and I like them done every year. So I've had some conversations with some parents this week, like it's time's ready for your next, kids next baseline. And I thought I was good forever once I got one done. It's like, no, your kid's still learning. So hopefully they get a little smarter, the balance gets a little bit better. We would expect to see changes from year to year. And if we don't have a baseline, then I'm relying on the parent a lot. Does Johnny usually have really bad balance? Yeah, well, I'm not sure. Okay. So, it's just one piece of the puzzle when I'm rehabbing them. We look at the whole thing, but it's hard. So, because there is no test to do. Like, I can't be like, Todd, get an MRI on this kid. Let's see if they're healed. Like, it just doesn't exist yet. So, University of Montana got a huge grant a couple years ago to study blood markers and concussions. So, but it's still not done. And, again, at the Amsterdam concussions, where they all get together. Yeah, in the lab study, they kind of know, but it hasn't trickled down to us normal providers yet, and it's not available. So, any
Good
other
information.
questions? Yeah. Anyway, so share with your friends or whatever, but we're all available. Like, this is your Bitterroot and Missoula group that, like, we know what we're doing with concussions. So lots of clinics are like, but most of them know to send them to one of us. So, well, thanks for coming, you guys. We appreciate it.
Take some handouts to share.
Yes, we have
your
lots.
teachers and your friends.
Yeah, or the coaches.
And your coaches.
And the coach.
Yeah.
Yeah, exactly.
Thank you.